Hi, Dr. Grove Higgins with Human Performance and Rehabilitation Center. There was an interesting article that came out, and it was actually on NPR originally, called The Lost Art of Bending Over. Basically, what the article is talking about is kind of the origins of back pain in the modern day, looking at the rest of the world and how they bend and how we've always bent before the modern day. They're looking at how does back pain originate nowadays. And there's a lot of different ideas, but there is one thing that's very interesting. The way we bend as Americans, especially in this sedentary society for the most part, is predisposing us to back pain. And here's why. The spine itself is made up of curves. And these curves are designed to be shock absorbing, and they're really designed much better for vertical loading. So when you bend over, you're taking this vertical loading structure out of vertical plane, and so now horizontally it doesn't bear loads as well. However, these big hip sockets, these big meaty hip sockets, ball and joint sockets, are very much apt for load bearing in all planes of motion, especially the horizontal plane. So what the article was looking at was the rest of the world, the way that they bend, the majority of them, is that spine stays relatively straight and the curves are maintained, and then they use what's called a hip hinge. So what we're going to do is we're going to take a look real quickly at Pat here as he bends improperly, both without a load, just this ball, and then improperly without a load, and then we'll show what it should look like. So as Pat here bends over, he's bending through his whole spine here. And even though the ball is relatively light, he's really loading the spine, and every part of the spine, the musculature is having to contract, and he's loading through the whole spine and doing very little loading through the hips themselves. And so even that light load down there can be a problem because he's bearing a lot of weight internally, so from his trunk. Now when he goes and picks up something heavy that same way, you'll see that this can become a real problem because now we're amplifying that load through the whole spine as it's bent. Now, if he goes back and he has better motion and he starts to do a hip hinge, and this is what a hip hinge looks like, he's going to shoot his hips backwards, maintaining this alignment of the spine relative to the floor. Now this whole area here is now loading the same way it did practically when he was standing up. And those hips, because now they're shoved back, his center of gravity is centered right over his legs, and he's able to maintain balance very well. And the hip joints and these large muscles, the glutes, the hamstrings, and the quads, are all doing the job of moving the spine, essentially from the pelvis up. And so as he lifts, he's really not doing much work with his spine at all. The spine is in relatively safe position. Now when he goes to do a heavy lift, you'll notice it doesn't look any different than it did when he did the light lift. In fact, it might even look better. So the heavy load and the light load look relatively the same, and that's what we want to be able to train the body to do. Now, Pat here is going to teach you how you can start to develop this movement yourself and develop a safe, mobile spine.
So let's talk about real quick how you can assess whether you have problems with the hip hinge or not. So we're going to be looking for three things for the assessment. The first is, do you experience any pain at all during the assessment? The second is, what range can you get to? And the third is, can you maintain the contact while we do a stick hinge? So the way we do the stick hinge is, and you could use a broomstick or any form of stick or bat or anything like that. We're going to hold at the bottom at our lower back. So we're going to maintain 3 points of contact. The first is this hand in the low back. The second is the stick maintaining contact at the mid back between the shoulder blades. And the third is that my head is maintaining contact with the stick here. So I can hold the stick at any point with the upper hand. I just have to maintain these 1, 2, and 3 points of contact. So to do the assessment, I'm going to take a slightly wider than normal stance. go to some soft knees, so just a slight bend in the knees, and I'm going to maintain that bend. I'm not going to bend any more in the knees. And maintaining these 3 points of contact, I'm going to hinge at the hips by driving the hips rearward, maintain my 3 points of contact, go down as far as I can. You want to go down slow. So my goal is to see if I can get to about 90 degrees in the hip. So 90 degrees would be just short of being actually parallel with the ground here. This is a good position. If I can get to here, this is good. Where we see problems is 1, pain, like we said, at any point during the movement. 2, can you not get to that 90-degree position without one of your points of contact coming off of the stick? And 3, are you losing any of your slight knee bend by bending the knees too much? For instance, if I come down here, the only way I can get down is by bending the knees further, which usually drives this rear hand, this low hand actually, off of the stick. So that's your assessment. Can you maintain 3 points of contact, slight knee bend, hinge backward to 90 degrees at the hip? So if you have trouble with any of that, there are 2 drills we would usually show people to try to gain a little bit more mobility in the spine in order to be able to do that stick hinge. The first would be a pelvic tilt. So I'll do this from the side because it'll be easiest to see. If I'm standing in neutral, my feet straight underneath my hips, soft knees, and my hands right on my belt line with the hips in neutral, I'm going to slightly tilt my hips forward, think tucking the tailbone, and rearward. So as I'm tilting, I want to make sure I'm leaving the lower back out of it. So I'm not driving the hips backwards with this movement. I'm simply tilting the hips slightly backwards and then slightly forwards. About 3 to 5 repetitions. There should be no pain and not an excessive amount of muscular involvement. I shouldn't feel like I'm crunching my abs to tilt the hips under. The second drill would be a thoracic glide. So this is for the mid-back. Your thoracic spine is from about the base of your neck to the base of the ribs here. Again, from the side, it's in that same neutral stance. I'm going to focus on my sternum as the point of, or my point of focus, because that's the easiest way. Put my fingers right in the sternum. And as I inhale, I'm going to drive my sternum forward. And then as I exhale, drive it rearward. Now notice that I'm not involving the shoulders. So it's not this movement. This is scapular movement. It's simply the thoracic spine. Again, keeping the low back out of it. Just driving the thoracic spine forward by thinking about your sternum going forward. And as I exhale, I relax the head and neck and drive the thoracic spine rearward. Here, 3 to 5 repetitions. And then what we always want to do is reassess whether we've gotten better. So you can go back to your stick hinge then to reassess and see, depending on what your issue was. If it was pain, can you get farther without any pain as you stick in? If it was range, can you get farther now while maintaining those 3 points of contact? Or if you'd lost one of the points of contact, can you now maintain it with a little bit farther range in the stick hinge?
So a lot of us develop the problems that he's trying to fix with this assessment and these drills because we're sitting way too much, we're wearing terrible shoes, and we're on hard level surfaces quite a bit. And a lot of these areas, the pelvis and the thoracic spine, get locked up, get a lot of tension. And so then when we bend down, we're predisposed to injury because we're not moving well. So the ideas behind this is to get the rest of the system to move well so that way we can do the hip hinge properly. And then it makes it easy to take a good moving system and put strength behind it. So that way you can make yourself bulletproof when you're bending over to pick up heavy objects or even light objects, or even just to tie your shoe, which is often where we see most people hurt their back, is picking up or doing something in very light, just in that bent over plane. So the idea here is get yourself moving well, have a tool to assess yourself and tools to drill, and then always reassess. If you're getting better, you'll know it. And if you're not, well, then you might need some coaching. And so comment below and let us know how we can help you get to this point where you can regain the lost art of bending over.